Right, let's get an update on the vaccination program for children between the ages of 12 and 17. Child Health Program COVID-19 Chief Director, Dr. Lesley Bamford, joins us now to give us that update. Doc, thank you very much for your time on all angles. How are we looking in terms of vaccinating this part of our population?
Good afternoon and good afternoon to the viewers. So as people know, we have been vaccinating 12 to 17-year-olds since October last year. To date, we've vaccinated about 1.5 million children in this age group. That's about 1.8 million doses. And so we are relatively satisfied. I think as people are aware, last year we requested that such children should come to our vaccination sites. It was not possible to vaccinate in schools because schools were busy with exams. So for the most part, we weren't able to vaccinate in schools. This year, we have continued to offer vaccination to this age group at our vaccination sites. But in addition, we are increasing the offering vaccinations in schools in an effort to reach more learners in this age group.
And of course, the fact that we have done away with the rotational timetable after that announcement by the Minister of Basic Education, it is more important now to make sure children are vaccinated than ever before, because now it means there's more of them at a time than about 4 months ago.
So exactly. I think the fact that we had vaccinated educators and that we had started vaccinating learners was one of the reasons why, or contributed to the decision to open up schools on a more full-time basis. But we would agree completely that as we go into winter, as the weather becomes less warm, we do need to make sure that everyone, including children in this age group, are protected to prevent them getting COVID and also to assist with reducing transmission.
And this court case that is still pending in Pretoria by some who believe that this should be halted, they've taken SAPRA to court. Are you concerned about what the court would say later, or you think they'll definitely rule in SAPRA's favor?
Well, I think one doesn't like to preempt these matters. Having said that, our program is aligned with programs in many parts of the world. We are confident that the vaccines are safe and effective in children. They have gone through all the necessary regulatory steps. And so we are very happy with our program. And for now, we are certainly continuing to recommend and encourage learners to be vaccinated.
And just lastly, Dr. Bamford, just your plea to parents who are still skeptical in terms of taking their children to get vaccinated?
Well, absolutely. I mean, I think we would make a plea to any South Africans who are not yet vaccinated. We are now in a phase where there are fewer COVID infections. We're in between waves. But there is a significant chance that we will still experience waves. And the more people that are protected, not only will that reduce hospitalizations and severe disease and deaths from COVID, but it will also reduce transmission and outbreaks, and thereby allow us to continue to open up society, the economy, workplaces, and to keep our schools open.
All right, thank you very much for your time. We appreciate it here on All Angles. That is Dr. Lesley Bamford, Chief Director for Child Health Program COVID-19.